Coming in here. When I look at the patients that come to me for pregnancy care, they're very thankful and appreciative. Gonna get started here pretty soon. But honestly, I think the gratitude of patients in abortion care is even more profound. Here at OHSU, we care for those patients just like everybody else. Historically, abortion care started in big medical centers and hospitals. But a number of political factors led to a shift out of hospitals into freestanding clinics. That was in many ways a big step forward in the way abortion care was provided. However, it also had some downstream consequences. Abortion providers began to be viewed as outside the mainstream of medicine. They're kind of viewed as rogue physicians.
Good afternoon, Downtown Women's Center. Yeah, we do provide abortion services.
There are many OBGYNs that don't provide abortion services in their own particular clinics for multitudes of reasons.
Do you have a sense of when your last period was approximately?
They can do the procedure, but they choose to refer their patients to come see us because they feel like we're the experts. As a clinic, that's all we do.
I'm a maternal fetal medicine doctor, retired now. We would take care of the pregnancies that have abnormalities. If we were worried that the baby couldn't make it and we offered the mom an abortion or termination of pregnancy, we had to decide where it could be done. And very few of the areas in Oregon outside of Portland can do abortions. So we would ask that the pregnancy be terminated at OHSU.
Nobody that comes through my clinic is interested in ending a pregnancy. That's not their goal. But when they hear about what's going on, when they hear about what's the life ahead, you just heard a new word called schizencephaly, and you don't realize that that means that the anterior part of your entire brain isn't going to work, that your cognition isn't going to work, that you're not going to be able to see or have meaningful interactions or eat on your own. And to eliminate somebody's option to get respectful, caring, expertise care, it's not acceptable.
Right. We are very fortunate to work here, but also to be in Oregon, where there aren't the limitations as there are in many states. And even later in pregnancy, when there's a really serious anomaly, we're able to help out.
To be able to rely on you, Mark, and your team who do such a good job of being not only full of expertise, but also compassion and empathy for everybody involved. We're very lucky.
I was a women's health care nurse practitioner with Multnomah County Health Department for 35 years. The county didn't do abortions, but we certainly saw a lot of women who just found out they were pregnant, weren't sure what they wanted to do. If there are members in the community that aren't supportive of abortion, then it creates barriers, fracturing of the referral and access process.
So now that we've gone over your medical history, I'm just going to
I
describe.
was always pleased with the quality of the counseling that went on in the clinics that offered abortions in town and the time they spent with young women talking about their options. You need a community to have a viable service.
In both of my practices, internally, there was all this support for providing abortions to our patients, but externally, they didn't want anyone to know about it. Mm-hmm. I basically had to say, I will add patients in.
That's kind of how it is in our practice too. It's like the folks that do abortion care will do it on their off hours or their admin time or their lunch hours, and it's fine and we're happy to do it, but it's just it's a little extra.
Yeah, and it has to be MA. I enrolled in a program that matches physicians who live in areas where there's a higher number of providers with communities that need people.
You're going to actually go to Kansas to work there as well?
Yes, I've talked to this woman. She's opening another clinic in Oklahoma City. And she has 2 physicians currently that she flies into Wichita because they don't have any providers that do second trimester procedures.
Oftentimes patients are walking into a hospital that may have a name that doesn't sound Catholic at all, and yet the doctors are not allowed to offer a full range of options.
Frankly, some other medical centers kind of view abortion as dirty work and they just don't want to be involved.
Had a young woman, the placenta was separating from the wall of the uterus and she was having really heavy vaginal bleeding. And she was coming from a hospital system that's a faith-based hospital system. And so even though her life was in danger, they could not perform a termination for her. It's not that the physicians don't want to help, but their hospital system is what limits their ability to act. And I think it's kind of an easy out for them to be able to say, oh, well, good thing OHSU's here, we'll let them handle this.
This is going to be the first time for you, so it'll be different. So what questions do you have? Oregon is an unusual place. Access to abortion is not available everywhere, but it's available. For many people in many places in this country, it's a huge challenge.
I'll spend 2 days, twice a month in the clinic there, and then come back when I'm done. I think there's a huge diversity among people who provide abortion care and what brings them to it, but I think there's a core value that women's lives and their autonomy is of utmost importance, and helping them through a difficult time is what matters the most.